Dr. Calhoun, thank you so much. Those are very kind words, and it's a real honor for me to be here today in Tyler with a longtime friend, Dr. Kirk Calhoun, and also with my friend, Senator Kevin Eltife, who's right here. Good. But I've been impressed with Dr. Calhoun ever since I first met him back in 2003. What an infectious enthusiasm he has for UT Health Science Center Tyler. And what a great job he's done over the last 7 years, taking this facility and turning it really into a world-class facility. And this biomedical research lab that we were just visiting, not only your director, Dr. Idell, but all of the specialists in really cutting-edge research. Just looking at the research being done to put a proteins into the lungs to reverse scarring so that people won't be bedridden, they won't have to be living their lives out with oxygen, they can walk, they can exercise. That's exciting. Not only is it exciting, not only does it make a difference in people's lives, but just think of what the economic impact of that will be for this facility. Dr. Idell was mentioning that the research that's being done is part of a grant from the National Institute of Health, $7.8 million. And all of that has not only a benefit on people's health, but it's got an economic multiplier. So it's paying people's salary, it's used to purchase supplies, it's being spent in the community. But that's just part of the story. Over the last 5 years, this center has been granted some $70 million in research dollars. And they've been able to do so much on cutting edge research, creating more jobs, and hopefully one of these days after the clinical trials are done, from this effort, you're going to see new businesses being developed and jobs created, and hopefully right here in East Texas. So not only is that $70 million in research important, but it helps in patient care and physician education. As we know, in the next 15, 20 years, we're going to need about 40,000 more doctors here in Texas. And that's why, as we were visiting, it's so important, your residency programs and having more residents so that you'll see more primary care doctors being introduced into East Texas. Most people don't realize it, but we're in the middle, well, most people understand we're in the middle of a national recession. But most people don't realize that we're doing better than virtually every other state. Our economy's stronger. And so the good news for hospitals, the good news for business people is that our population here in Texas is going to double in the next 25, 30 years. We're going to go from 25 million people to roughly 50 million people in the next 25 to 30 years. And during that, less than that time period, we're going to need 40,000 more doctors, and we're going to need more care and more doctors in East Texas. And I also wanted to mention we've got a real shortage in nurses, and so we're going to have to also, as we train more doctors, we're going to have to focus on training more nurses. That's why this past year in the legislature, we put some $35 million and designed in our Senate Finance Committee by Senator Eltife and other fine senators, but we want to double the number of nurses that are graduating. Because right now we've got a shortage of about 22,000 nurses in Texas. If we don't do anything, in the end of this decade, we're going to be short 71,000 nurses. So from a point of view of workforce development, literally, if we could just graduate more, there's a need right now. 22,000 jobs are going waiting. And again, one of the things I'm proud about in the legislature is that in 2003, we saw a crisis that was brewing. In the year 2000, 2001, 2002, we saw a net exodus of doctors from Texas. Medical malpractice rates were shooting through the ceiling, frivolous lawsuits. And so we addressed this problem, I think, with one of the model pieces of tort reform in the country. And since September 1st, 2003, we've had over 17,000 new doctors licensed to practice in Texas. But we've got to do more. That's just the start. So, this is a great facility. I am very impressed with the work that Dr. Calhoun and his staff have done in turning this into a first-class faculty. And I know that it's going to stay this way because one of the strongest advocates that we have in the legislature for not only this district, Tyler, but also UT Health Science Center in Tyler, is a friend of all of ours, a friend of mine, Senator Kevin Eltife. And so I'm going to ask Senator Eltife, if he would, to come to the podium.
Thank you. Thank you. Enough. And you're kind of a hidden treasure because we don't all drive down 271 every day. But we appreciate all that you do. And I want to tell you about this Lieutenant Governor who's standing here with us today, David Dewhurst. There has never been a time in my 7 years in the Texas Senate that we have had a problem or an issue for Northeast Texas that I've not walked into his office and said, Governor, we need your help. We need more funding. We're getting shortchanged in finance. The formulas aren't right. That he has not stepped up and said, what do you need for Northeast Texas? The reason that academic building is going up over there is because Governor Dewhurst insisted that the $21 million in bonds be put in the budget during that year, directly because of him. We should be proud that we have a statewide elected official who's a former successful businessman from the private sector who gets it and who cares about every part of this state. So Governor Dewhurst, we're honored to have you in Tyler today, and we appreciate all that you do for our entire state. And at this time, I'm going to introduce someone who doesn't need an introduction, an incredible man that it's unbelievable that we have him here in Tyler, Texas. Dr. Idell, who has 25 years worked on the research for pulmonary fibrosis and who's known throughout the world. And how we have secured you and kept you here all these years, I don't know, but we're honored to have you, and we appreciate all you do for all of us in this institution. Dr. Idell.
Have the Lieutenant Governor visit us today. Also honored to have Senator Eltife come and talk to us. It was great to get you to see the personnel working in a working lab. And I just want to say that we have some of the best scientists in the whole world located right here in East Texas and generating 140 jobs here in Tyler. Now, you've heard about the amount of money that this operation throws off, but the fact is that our real product is research. Cutting-edge research that we hope is going to provide new cures for people that have little hope and who now need new hope and get it from us. So we thank both the members of the legislature and the Lieutenant Governor in particular today for all the support that we've had over the years. This institution has grown greatly over the past 25 years, and I, like my colleague Dr. Pengburn, have gotten to see that, and it couldn't have been done without the support that we've had from the state, the legislature, and from the Lieutenant Governor. Thank you so much.